So if you're a man or a woman and you're starting hormone replacement therapy, whether that's testosterone, estrogen, progesterone, what should be your realistic expectations on a timeline of symptom relief? It's really individualized and it depends on where your dysfunction is at. But I'd say the vast majority of people cognitively are usually going to experience something almost instantaneous. Usually in the first week or two, getting their hormones optimized, they're going to notice something: drive, cognition, decrease in brain fog, increase in motivation and libido. Now with other things, say like body mass composition, it's going to take longer. You know, it's very similar to the gym. Like once you start going to the gym, you're going to usually notice some dopamine, serotonin improvements almost instantaneously, like the day you do that workout. But you know, I'd say it's going to take at least 3 months for you to look in the mirror and say, yeah, I'm noticing some changes, and really preferably probably 6 months to where you're like, definitely some changes. Now, sexual dysfunction for guys, especially depending on how severe it is, like can take 6, 9, sometimes even a year to where their sexual dysfunction is back to, I wouldn't say optimized, because look, you're never going to be 18 again, but definitely back to where there's a good amount of symptom relief. And in all of these things, you're going to notice a progression. It's not just like wham, in a week or two, you put on 20 pounds of muscle, you lost 10 pounds of fat, your memory is sharp, your cognition is good, libido, motivation. These things all take time. And in my experience, a lot of patients will continue to notice benefits for years. At the very least, after you've been on it for a while, instead of digressing, you're at least preventing decline, preventing cognitive decline. And I am a muscle maxi. I think that as you age, having more muscle, it's going to prevent falling down the stairs, breaking your hip. You end up in the hospital, you get pneumonia and die. But not even that, having more muscle mass increases your sensitivity to your blood sugar, keeps your blood sugar lower. Just overall, having more muscle mass is going to help you fight off aging. It's going to give you better mitochondria for blood glucose regulation, for neurotransmitter creation, destruction. It helps with your metabolism. So it really depends on where you're at when you're starting. But again, I'd say most people cognitively a couple of weeks. Body comp, it's going to be 3-6 months. Sexual dysfunction can sometimes take up to a year.